Hey everyone, and welcome. Today we are diving deep into the incredible, ever-changing world of heart health. We're going to break down what's happening in cardiology right now, and more importantly, what's just around the corner in 2026, so you can start building a healthier heart today. So let's kick things off with the big question, right? What does a heart-healthy future actually look like? It's so much more than just not getting sick. It's about proactively building a foundation for a stronger, more resilient heart for years to come. And that whole journey, it really begins with understanding how this amazing machine works. First things first, let's get on the same page. What even is cardiology? Well, the technical definition is right here. It's the medical specialty for your heart and blood vessels. But honestly, a much better way to think about it is as the official owner's manual for the most important engine you will ever have. And that's a perfect lead-in to our first section. We're going to really understand that engine. So let's pop the hood and take a look at your heart's absolutely incredible blueprint. It's so easy to take it for granted, but your cardiovascular system is working tirelessly every single second of every single day. Its main jobs: pumping blood, delivering oxygen, basically maintaining the life force of your entire body. This thing isn't just a simple pump. It's this incredibly complex delivery network that fuels literally everything you do. It's nothing short of a masterpiece of biological engineering. Okay, check this out. Your heart has this amazing four-step dance it does all day long. First, blood that's low on oxygen comes into the right atrium. From there, it gets sent to the right ventricle and boom, pumped off to the lungs for a refill. Then, that fresh oxygen-rich blood comes back into the left atrium. And finally, the super powerful left ventricle pumps it out to your entire body. It's this perfect, continuous loop, beating about 100,000 times a day. Wow. Of course, even the best engine can face some challenges. But instead of thinking about these things as scary diagnoses, let's try to frame them as, well, navigable roadblocks. And, knowing the map is always the first step to finding the best way around them. So here's a quick look at some of the usual suspects. You've got coronary artery disease, which is kind of like plaque causing traffic jams in your arteries. Then you have arrhythmias, which are like a little electrical glitch messing with your heart's rhythm. And heart failure? That doesn't mean your heart stops. It just means it's having a hard time pumping efficiently. And then there's hypertension, or high blood pressure, which puts the whole system under constant stress. And let's talk about that for a second. There's a very good reason high blood pressure is called the silent killer. See, it often has no symptoms at all, but behind the scenes, it's silently straining your heart and damaging your arteries over time. This is exactly why keeping an eye on your blood pressure isn't just a good idea, it is absolutely crucial. So, how do doctors even find these roadblocks, especially the silent ones? Well, let's move on and geek out a little bit with cardiology's high-tech toolkit. We're going to see exactly how they get a crystal clear picture of what's happening inside your heart. The technology we have now is just incredible. On one hand, doctors can use non-invasive tools like an echocardiogram, which is basically an ultrasound for your heart, to watch it beating and pumping blood in real time, all from the outside. But if they need a closer look, they can use something like cardiac catheterization, guiding a teeny tiny tube right through a blood vessel into the heart itself to both diagnose and sometimes even fix a blockage right then and there. And really, that's just the start. The modern cardiologist toolkit is huge. You have the classic ECG or EKG to check the heart's electrical rhythm, stress tests to see how it handles pressure, and even wearable Holter monitors that can track your heart for days at a time. You combine all that with incredibly detailed imaging from CT scans and MRIs, and doctors get this complete 360-degree view to make the perfect plan for you. Now, all this technology is amazing. It truly is. But it all leads us to maybe the single most important part of this entire conversation. These tools empower doctors, yes, but at the end of the day, you are the captain of your own ship. It's time to take the helm. And you know what? It can start with just one number. 150. That's it. That's the recommended number of minutes of moderate aerobic exercise you should aim for each week. Now, that might sound like a lot, but break it down. That's just a little over 20 minutes a day. A brisk walk, a bike ride, that's really all it takes to start seriously strengthening your heart muscle. You can do that. And of course, exercise is just one piece of the puzzle. It's really about the whole picture. A heart-healthy lifestyle is a balance of what you eat, staying active, and keeping a healthy weight. But it's also about managing your stress, getting good sleep, and this is a big one, quitting smoking for good. Each one of these supports all the others, creating this powerful, strong foundation for your heart. Now, being the captain also means knowing when it's time to send out an SOS, when to call for help. So I have a very direct question for you. Do you actually know the warning signs of a heart attack? Because recognizing them and acting fast could literally save a life, maybe even your own. So please, take a good look at this list. These are the signs you can never, ever ignore. A heart attack isn't always that dramatic, chest-clutching scene you see in the movies. It can be much more subtle, like a sudden, extreme fatigue or an ache in your jaw. The bottom line is this: if something feels wrong, don't wait. Don't try to tough it out. Getting help immediately is the most important thing you can do. All right, let's shift gears and look ahead. We've talked about how the heart works, the common challenges, the tools we use, and your crucial role in all of this. So, what's next? Let's take a little glimpse over the horizon at the future of heart care. And this is where things get really, really cool. Think about this progression. Today, we have wearable monitors giving us real-time data on our wrists. By 2026, we're looking at predictive AI that can take that data and potentially warn us about a heart issue before it happens. And beyond that, we're talking about personalized medicine, tailored specifically to your unique genetic makeup. The whole focus is shifting away from just reacting to problems and moving toward preventing them from ever happening in the first place. And what's fueling a lot of this incredible evolution? Telehealth. And listen, this isn't just about having a video call with your doctor anymore. It's about continuous, remote monitoring that lets your care team keep an eye on things and be way more proactive. It's making healthcare more accessible and personalized than it has ever been. And this right here, this really brings everything we've talked about together. Look at this chart. Of course, medical intervention is absolutely essential. But your own personal responsibility? It's right up there, just as important. Real, long-term success is a partnership. It's a balance between cutting-edge medicine and the choices you make every single day. So we end right back where we started, with a question for you. Your heart's future isn't some far-off, distant thing. It's being written right now, with every beat and every choice you make. The only real question is, what will your next chapter be? Thanks for joining me.